We're going to talk about night shift nursing. All right. As a DO1, you know, you're only as strong as a team that you have. All right. And I started out as an LPN, right? And then worked my way, went back to school for RN, and then worked my way up the ladder. So I want to start talking about more positions that we deal with in long-term care. All right. So I want to talk about how to have an effective night shift. All right. If you are the supervisor. And even as a nurse working. All right. So the first thing you want to do, of course, you're going to get report, right? But then you're going to print out your census. It's always to know who is in your facility at all times. Even though you might have bed holes, you might have people who were transferred out to the hospital or discharged. Okay, you might have a person that was discharged and it wasn't taken out of your computer system. Complete your staffing sheet. Okay, you need to make sure that you have enough staff in order to meet the needs of the facility. Complete chart checks. Night shift is your compliance. Okay, this is where compliance be at its highest, because anything that you do on day shift and evening, night shift is making sure that it is signed, sealed, and delivered, and coming back to that morning clinical. Rounding on your high-risk residents, those can be anybody who have wounds or IV therapy, high fall risk. You want to make sure you're rounding and seeing those patients, and then documenting. Okay, remember, if it's not documented, it is not done. You want to check your WonderGuard systems, your code cards. Preparing for labs and appointments, a biggie. Okay, it's nothing more frustrating from day shift than to find out that there was an appointment and paperwork wasn't done. Checking your glucometers, your medication rooms, your med cards, ordering medications, a biggie. This is where night shift really needs to start looking through those carts and seeing what's due to be ordered. Checking your pantries and refrigerators. Handling scheduling adjustments for any type of day. If someone calls out, you want to make sure that you adjust the schedule to meet the needs again for the facility. Preparing assignment sheets, and this is so that when day shift come, they can get report and they can hit the floor running. Updating your care plans and assessments. Change out your urinals and bedpans. These are things that you would be telling the CNAs. Restocking supplies and doing environmental rounds. And make sure you take your take your break. You have to take your break. But I wanted to just say this: if you are signed up for my email list, I highly encourage you to do so, because I'm literally putting out a blog every day, and it's all to serve my community. Long-term care. How may I help you? Have a great day, and as always, like, comment, and subscribe, and follow for more tips.